But today they also, officially declared na critical na, no, yung level, di ba? And OCTA has called it severe. We're wondering, given the slight decline, whether we're just beginning to reach the peak or whether we've already peaked. Anong basa niyo dun sa critical? Now that we're critical, how long will this probably take? Kaya?
Yeah, so the projection that they are saying that this is not yet the peak. It could the cases could still increase, but we still don't know. We will just base on the trend on the number of cases that we from the DOH that they officially report.
Are the hospitals feeling it? Are the hospitals feeling the critical level?
So right now, based on our report, some of the hospital are already at critical risk. However, when you look at it on a regional level, we're still at moderate level, moderate risk, because there are still areas or there are still hospitals that have vacancies.
Okay, but let's isa po natin yun. Let's go by the regions. Of course, starting with NCR. And for that matter, the other urban centers, ano po yung itsura nun? We have to emphasize, as we said, no, pagka-critical, we're not just looking at the number of cases, we're also looking at the situation, occupancy rates, and so on in the different hospitals. So on a regional level, ano po itsura nito?
So for NCR, we're already at moderate risk for the COVID ward beds. But unlike Delta before na biglang tumaas talaga yung occupancy natin sa hospital. But right now, we're seeing a lot of mild cases. That's why they're not inside the hospital, or we're trying to move them out from the hospital. So far, NCR is the only region that is at moderate risk, and the rest of the regions are at low risk.
Doctor, ang problema ngayon, yung kahit hindi pa napupuno masyado yung beds, ang problema are the healthcare workers who are getting infected. Now, the Philippine Hospital Association, sabi nila, they're not bound naman daw by the order na i-shorten yung quarantine ng healthcare workers. Ano yung plan B nyo kung sakasakaling kulangin na nga tayo ng healthcare workers dahil sa dami ng infection?
Yeah, correct. So there's a lot of requests from the health facilities that their healthcare workers are getting sick. That's why we're isolating them. So that will directly affect the number of beds available in the facilities. So what we are currently doing, so as you know, DOH already released the shortened protocol based on upon the approval of the Infection Control Committee of the facilities. That's Plan A. Plan B is actually we're already implementing Plan B, which is augmentation from other agencies. Yung mga medical health workers nila, we're already augmenting them to the hospital, like we're tapping AFP and other agencies like PNP and BFP, and we're looking at other regions din po, no, na that could also augment in NCR.
From the other regions, you mean we're getting more healthcare workers?
Just like what we did during the Delta surge. So what we did is we look into those regions that have that are still at low risk. So we ask for their help and then augment it to the region. So same thing that what happened when other regions were already in surge. NCR naman yung pumunta doon sa mga regions na yun.
Pero sabi ng OCTA, if we follow the pattern of surges before, it starts in NCR and then after a few weeks, nasa regions na. So I guess your planning will have to factor in the possibility that the regions may soon be also high risk, no, or moderate risk, in which case they will need their own hospital healthcare workers.
Yeah, correct. So it's a repeat of what happened before, no, with Delta, Alpha, or whatever variant it is. So parang tuloy-tuloy lang from NCR and then going to Region 3, Region 4A, and then down to Visayas and Mindanao. So what we are currently doing is asking the hospitals to prepare to stockpile, check their logistics so that they'll be ready anytime.
Doc, kamusta
Yeah,
yung utilization sa sa regions 3A and 4? Kasi we heard na doon tumataas ngayon as per Okta a few days ago. Doon ngayon tumataas yung numbers. How are they in terms of ward beds, isolation units and ICUs?
So right now, based on our report, for Region 3, we're still at 35% or 35 to 40% utilization rate, while for Region 4A, we're at almost moderate threes from 45 to 55%.
Tumataas na rin
Tumataas na
55%.
din. We can see na medyo tumataas na din yung utilization rate natin.
70 yung critical no? Yung talaga
70 is high risk.